Everybody, Michael Johnson here with Meta Johnson and Associates, bringing you today a fun little word, confabulation. So, normally when we're working with people living with dementia, we think of memory loss. Confabulation is a distortion of a memory. So when you think of memory loss, you think mom might not remember the doctor's appointment last week. Confabulation would be mom remembers the doctor appointment, but her memory is that the doctor said she doesn't need to take her heart medication anymore, when that in fact is not what happened. It's different than psychosis, where someone has a distorted sense of reality in the present, because in the present they're feeling and interpreting the world around them differently. It's difficult for families to understand because a lot of the times the confabulation sounds and totally possible. And as the person recounts it to you, they are absolutely certain that this is how things happened. Know that they're not trying to deceive you. It's truly a distortion in the memory that was saved in their brain, but mixed up with some things. And it's also challenging for when you have remote family members that may be talking to the person experiencing confabulation and hearing a report totally different than the reality of things. But again, it sounds reasonable and possible, and oftentimes it does kind of play out how things happened in the past, that the doctor's appointments always went well. And so the remote people often think, well, why is everybody a fuss? Because really, mom's fine, or this is how things went, when it's not. So that can be really tricky. What to do? Choose your battles. If the person is experiencing confabulation and remembers something totally differently and it's innocuous, you don't really need to correct them every single time. It becomes problematic when the confabulations do relate to important medical, healthcare, or safety issues. If those start becoming more and more problematic, it may be time to activate a healthcare power of attorney, or as a last-ditch effort, in severe cases, guardianship. That is really only for when the person's confabulations are so severe that their health and safety is at really imminent risk, and it impairs their safety and well-being a lot. So I hope that's a nice in-service for you all. Again, it's one of those things where it can be difficult to understand. Know the person is not trying to trick you, and that it's simply a symptom. Again, I mentioned it can be found in certain dementias, especially frontal temporal lobe dementia, dementias related to excessive alcoholism in the past, also known as a Korsakoff-Wernicke syndrome, and sometimes traumatic brain injuries. Hope that helps.